Good afternoon, I'm Andrea Elbers. We are interrupting ABC programming to bring you a live update from the Crosse County Health Building, where county officials are holding a press conference, and we expect to learn new information about the spread of COVID-19 in our communities. Let's listen in live as this press conference gets underway.
Media about that. I want to tell you a couple of details about that case. So first of all, this is an individual who is in his upper 20s and is someone who was attending a college down in Madison. And so we believe that this individual may have been exposed actually in the Milwaukee area. So this is someone exposed here in Wisconsin, was there between the 13th and 15th, and symptoms began on the 15th. Symptoms for this individual included initially some minor muscle aches, and then quickly overly tired. On the 16th, developing a sore throat. On the 17th, a dry cough. And then on the 18th, fever and chills. So the classic symptoms, however, understanding when they came about with this particular case is helpful to know. The individual came back to our county on the 15th and has been in isolation since the time that they came home. So gratefully, there is not a lot of exposure, no exposure essentially, besides this individual's significant other, who is also a college student and has been in isolation as well with the spouse. So that essentially means that our contact tracing is focused on connecting with other communities where this person was during the potential exposure period, and that includes Milwaukee and Madison as well as Eau Claire. So we're in contact with those areas to let the health departments in those areas and any facilities that they were in let them know about the potential exposures there. As I indicated, this person is in isolation, has not been around our community since coming back home to La Crosse County, and had some classic symptoms that we are normally looking for. So those are the details about the fourth case. Starting from this point forward, what we're going to do is no longer notify about every case that comes along. We will have a daily update on our website at a specific time, and we'll let you know when to look for that. However, the first case that we identified to be community spread, meaning we can't find where someone had traveled to a specific location, for example, that we'd be concerned about, we will notify immediately or within that 1 to 2 hours of when we get that particular case. And I say 1 to 2 hours, but do understand it has to be enough time for us to find out that there was community spread. So it could be that the case comes into our system, we're actually doing contact investigation, and then it might be a little later than when it actually comes into our system, but it'll be 1 to 2 hours from when we determine there is community spread with this particular case. A couple of the things that I want to address, we're getting a number of questions, and I want to clarify some items for those in our community. So I want to talk a bit about the contact investigation process. There have been a lot of questions about why don't we notify about a particular location where someone is, about where they live, where they've been, all of those sorts of details. And that's because we have investigation staff who have done communicable disease investigation for decades, and they have lots of experience with having communications with those individuals, motivational interviewing to determine where those people were, who they might have been in contact with. And it's important here to note the disease process and how the disease process works. So with this particular case, we're talking about, or this particular virus, we're talking about spread by droplets. And I've mentioned this before, but I want to reiterate it. I think it's really important. So when someone coughs or sneezes into the air and you're within 6 feet of that person, you might pick up those droplets from the space between you. And then in addition, if you cough or sneeze and that lands on an inanimate object, there is potential that someone who isn't sick touches that surface and then brings it to their face and exposes themselves. And this is why our messaging continues to be social distancing, staying 6 feet away from anyone else. Particularly if you know that person is coughing or sneezing, you do want to keep your distance. But even if you don't know that, I think that's just the best mechanism that we can protect ourselves. In addition, it's the washing your hands, it's the cleaning of the surfaces around you and not touching your face. That helps you avoid potentially contaminating yourself and exposing yourself to the virus. So I think those continue to be really important messages based upon what we know about how this virus spreads. We are getting a lot of questions from particular sectors, including childcare providers, those that do personal care work with an individual in a close contact setting. Again, it is keeping social distance whenever possible. It continues to be the messaging of washing your hands and not touching your face. If someone does have a cough or is sneezing, I think you would want to raise that up to your manager. Like say, for example, you're working for a personal care agency or home health, for example, you would want to raise that up and say, I would like to know, in order to determine my potential exposure, I want to know how you want me to handle this. So I think that level of communication will continue to be really important. I do want to indicate that after yesterday, the health department in particular has really ramped up our incident command system. And those of you who might understand what incident command is, it is a process that helps organize situations like this where we continue to get cases. We're going to continue to get cases. Now we're spreading out, having nurses and other health department staff who are really good at contact investigation. They're heavy into that work. We need to then redeploy all of our resources in order to make sure we have messaging going up and down that chain in a way that we can be really effective for our community. So I tell you that because I want the community to understand we take this very seriously and we're doing a really good job of managing our resources in order to respond to this for our community. We want to make sure we're taking care of ourselves so we can continue to take care of you. And we are doing a very good job of that. And our partners are doing the same. I do want to let folks know that we have gotten a number of questions about testing in particular. So I'm going to let Bridget take it. Bridget is from Gunderson Infection Control. And I do just want to indicate we did invite both Mayo and Gunderson, and we will continue to do this for our daily briefings. And one or the other will be present based upon their availability at this time each day. So please don't think that we are only inviting one agency, for example. But Bridget, would you talk a little bit about testing?
Yes, for sure. So Bridget Paff, again, Administrative Director for the Infection Control Team at Gunderson. And I would emphasize related to testing and whether it's the travel. We obviously saw 2 days ago, we were talking about 0 cases in Crosse County. Today we're talking about 4. This is going to continue to elevate. And we are also seeing information on testing on a national, state, and local level changing. So important message for everyone is call before you come in, because somebody who we may have tested yesterday may not qualify for testing today. Meaning we know that there's some areas that there is going to be spread, and we want to make sure that we're conserving tests for appropriate people. Those people would include the extremely susceptible patients in nursing homes and long-term care settings, people who live in that community area. Where is the risk? We're asking everyone for that social distancing right now and to isolate at home if they're sick. When's too sick? What does that mean? We're posting information on our website, what you need to know as a member of the public for prevention. As Jen said, we've got decades of public health surveillance. We've been working with most of these people, myself for 2 decades have been working with a lot of these people, and those relationships and those contact investigations in this community, we are working with great partners. We're on the phone with our colleagues at Mayo, our colleagues at the health department. I think we had maybe 5 phone calls this morning. So it is constant collaboration and communication and partnerships and sharing. Our testing criteria is changing. If you call and you're screened, we don't need to test every single contact in a household because there's a quarantine or isolation order suggestion in place. We also will continue to evolve the criteria related to I went to Chicago or I went to California. Which of these people need to stay home from this point on? Most of the things are closed right now. If you need to go out and get some groceries, certainly be thinking about wash your hands, and then wash them some more. But then also be thinking about the other things you can do. You know, you might want to get outside and take a walk, but we don't want you to just gather all the teenagers in your basement because they're off of school. So thinking through, again, all of those different pieces, the lab testing, and then going into this touches every aspect. And if we're all doing the right things, the hope is we're going to interrupt that curve. We're all reading about that. But what about this? And I read this, and in such and such a state. Go to your most reliable resources. La Crosse County Health Department has some great resources. We have things on our website at Gunderson. Obviously, I'm surprised the CDC website hasn't crashed this month with everything happening, and we want to make sure that we're thinking through what they're bringing forward as well. The CDC website, there's a lot of unreliable information out there right now. Go to your trusted references.
Thank you, Bridget. And I'll just reiterate, in terms of testing, remember, if you have symptoms, the message would be stay home, and that if you have questions about those symptoms, you would want to contact your healthcare provider, and they will appropriately triage you through to determine if you need to be tested. And I just reiterate, we don't need to know the result of a test to know if we're symptomatic, we should be staying home.
Yeah, I would say, because I don't want to say, well, this is the group we're testing right now, and this is the key things are what I said. Those long-term care people, essential workers, healthcare workers, our folks in the police and fire that are protecting ourselves, depending on the situation. Again, there's different people who are going to make it into that group of people who are being tested. We want to be thinking about it could, if we had a new test approved, if we got a new shipment, that those orders could change tomorrow on what ability and where to go for testing and screening. We talked yesterday about a drive-up ability to test at both healthcare facilities in our community. We're working on increasing that capacity throughout our regional sites. Not every single place will be a testing site, but we want to make it as available as possible within our system.
Please.
I'm not sure exactly who it's for, but so feel free to chime in, either one of you. Can you tell me when it comes to testing, does it sound like you think it would be a good idea to test more people? I mean, we keep hearing that there are asymptomatic people, plus you have people that are...
Okay, and you've been listening in live to a press conference taking place right now at the La Crosse County Health Building, the health department director there, also someone there from infectious control with Gunderson. And they were speaking about the 4th confirmed case of COVID-19 in La Crosse County. That's some information that we learned earlier today, and this afternoon some extra details were provided about that 4th case. But we also learned that the county will no longer be notifying about every single case that is confirmed. That's because they expect that number to keep increasing. That's one reason. The second reason is that they're kind of changing these guidelines here, these rules for releasing that information, because it does take up time and resources to do that. So the exception to that rule is if there's a confirmed case with community spread, they will of course be notifying the community. And they're asking that if you have symptoms, the message remains the same: stay home. Stay home. If you have suspicious symptoms, you are to call ahead to your healthcare provider. When you call ahead, you will be pre-screened and you will be told whether or not you meet the criteria for testing. As we just heard, that criteria for testing is changing. It's fluid. And that's because there is a fluctuation in the number of available testing kits. And they want to save those tests for vulnerable patients who may be living in a community-like setting, for example, a nursing home, or people who are working in close contact with a large group of people, for example, a healthcare worker. So again, a little update here from La Crosse County. The 4th case in the county of COVID-19 has been confirmed, and we'll continue to bring you the most up-to-date information on WXOW News 19. Of course, our on-air coverage will pick up tonight on Live at 5, but right now you can head to our website, WXOW.com, for the most up-to-date, trusted resources, comprehensive reporting on our coronavirus page, WXOW.com/coronavirus. Thank you for watching. For now, we're going to return you to local programming.